Hi, I'm Dr. Joel Hunter, and I'm an ophthalmologist. And you know what I noticed? There are not a lot of good videos on the internet on how to do a refraction. So I said to myself, we should make one. The following is a video on how to perform a manifest refraction in order to get the perfect pair of glasses. To figure out someone's prescription for glasses, we need a phoropter. And this is a phoropter. It was invented 100 years ago, and it's so good at figuring out a glasses prescription that we still haven't figured out a way to do it better. Over the next few minutes, we're going to look at what it takes to use a phoropter to do a refraction. And that means turning knobs and dials to transform these lenses into the exact lenses your patient needs for a perfect pair of glasses. It works if the setup is set up right. The patient's head needs to be even, and their eyes have to be looking through the middle of these openings. People have different sized heads, so the distance between the eyes varies, and that's called the IPD, or the interpupillary distance. And you're turning this knob to get the right IPD so their eyes are centered. It'll usually be a number between 55 and 65 millimeters. We're only checking one eye at a time, so you'll have to occlude the other. Luckily, this dial has a setting marked OC for occlude because that's what it does. And by the way, almost the only thing you'll ever use this dial for is to open it or to close it. That's open or occlude each eye as you need. Every glasses prescription has three parts to it. And that describes the amount of hyperopia or myopia. The second one is the axis of astigmatism, and that's the direction that the astigmatism is oriented between 1 and 180. And the last one is the amount of astigmatism. It's also called the cylindrical power, and that just simply describes how much astigmatism is there. These last two are in the category of cylinder, which is the word we use to talk about astigmatism when we're doing a refraction. It's different than sphere, and it doesn't have anything to do with how we fix astigmatism. All of this correction is measured in a unit called diopters, and the units you find on the dials are always referring to diopters. They're always in quarter steps, and those quarters are quarters of a diopter. First up, and it'll always be first when you're doing a refraction, is the sphere. If your patient's myopic, then their glasses will make things look smaller. And if they're hyperopic, then their glasses will make things look bigger. So we'll start with 0, and we'll say better 1 or better 2. It's helpful to stick with 1 or 2 the whole time. That way you don't end up counting higher and higher and confusing everyone, including yourself. 1 is the number you're at, and 2 is the new choice. Make it big steps to start if you know they're pretty blurry. Usually a whole diopter at a time. 4 of these quarter clicks will save you a lot of talking and testing to narrow in. We're going from big changes to get close to tiny incremental changes to fine tune. Once 2, choice 2, isn't making things better anymore, you can change to quarter diopter steps and see if small changes make things even sharper. When the image isn't getting any clearer, we're done here. We can move on to finding the axis of astigmatism. If your patient has any astigmatism at all, it's going to be at a certain axis, and that axis will be able to be found by using even a small amount of astigmatism correction. That means even if your patient has something like 4 diopters of astigmatism, you can still find the axis using only a small amount of that power, because that's where they'll like the correction best. So that's why we always use only a half diopter of power to fish out the astigmatism axis. When we're fishing for astigmatism, we're assuming that having a half a diopter of correction close to the axis where the patient has astigmatism will look better than not having that half a diopter there. And that means we only need to check the major landmarks of a circle. That's 0, 45, 90, and 135 degrees. At each of these landmarks, we'll say better 1 or better 2. And 1 will be 0 power. 2 will be a half a diopter of power there. And if 1's better, well, then we move on to the next landmark. Now, if 1's better every time at each of those 4 landmarks, hooray! Your patient doesn't have any astigmatism. You're done with your refraction because you've corrected their only problem, which was simple myopia or hyperopia. Now, if they pick 2 at any point, then that means we have a catch on our fishing trip for astigmatism. It means they have some astigmatism somewhere near that axis. And now we must fine-tune that axis. Just like with spherical power before, we go from big coarse changes down to fine-tuning. Now, with axis of astigmatism, we've found where it is in general, and we fine-tune to find the exact degree of astigmatism. And for fine-tuning the axis of astigmatism, we use this very impressive looking device called the Jackson cross. We're finding the axis, so we need to align the axis of the Jackson cross wheel with the axis of our main cylinder axis dial. If the Jackson cross is turned wrong, none of this will work, so you got to make sure it's right. There will be a click. We're using a minus cylinder phoropter here because most phoropters are minus cylinder. On these phoropters, the red dot means minus and the white dot means add. For this, when we're trying, it's the red dot that we will be chasing. How? We will flip this Jackson cross lens and ask, better 1 or better 2? For this, we don't care about the number they pick. We care about where the red dot is when they pick that number. Wherever the red dot is, we want to move the axis towards it. Follow the red. We're trying to find the exact axis of astigmatism, and that's going to be when choice 1 and 2 are bad, depending on how optimistic or pessimistic your patient is, but they will be equal. Flipping that dial doesn't make any difference at all. We don't have any red dot to follow, and now we have found the exact axis of their astigmatism. Now that we found the axis, our job is to find the amount of cylinder, the cylindrical power. This is how much astigmatism your patient has. Now you can use the Jackson cross to do this, but a lot of times it's more harm than help, and so Jackson cross. Instead, you can use the actual knob that dials in cylindrical power. What you want to do is pick a letter on a line that's relatively easy for them to read. For instance, if they're easily reading 2020, then a letter on the 2025 or 2030 line works best. And that letter happens to be the letter D. That's the best letter for figuring out how much astigmatism your patient has. So now we go back to saying better 1 or better 2. 1 is where we're starting. 2 is a half a diopter more cylinder power. As they pick 2, you move up and then check again, better 1 or 2. When you hear found the general range of cylindrical power they have. Almost always your patient will pick to have a little bit more cylinder correction, and so you have to be careful with this. If you only listen for 2, you'll keep climbing and climbing in how much cylindrical correction there is. When you hear that hesitation and they say 2, that's when you want to stop and start fine-tuning, and you can move down to quarter steps, and you can even test their vision on a smaller line to see if it's any improvement with more cylindrical power. You're almost done. Let's finalize it. It helps to go back and do one last thing with spherical power to make sure that the lenses you've added haven't changed anything. This test is called clicks to blur, and we're looking for the specific amount of clicks it takes to make the 20/20 line absolutely. You'll show the 20/20 line and you'll ask the patient to tell you when they can no longer at all on that line. Not when it's blurry, not when they can barely do it, but when it's absolutely impossible. Then add power to the sphere 1 click, 1/4 diopter at a time. The correct number of clicks that should blur a 20/20 line to absolutely impossible is 3 clicks. There should be 3 clicks to blur. If there are more, then you've accidentally over-minused the patient. You should increase the minus by 3 clicks from wherever it becomes impossible. And they almost always will be able to. On to the recap. Level the phoropter and ensure the patient is comfortable. Occlude the left eye. Diopter steps. Once the image isn't getting clearer, move along. Determine the cylinder axis by using a small amount of power at each 45-degree landmark. When the patient prefers the increased power, they likely have astigmatism near that axis. Fine-tune the axis with the Jackson cross. Align the Jackson cross wheel with the cylinder axis dial. Make sure to listen for the click. Then you'll be flipping the Jackson cross and chasing the red. Determine the amount of cylinder using half diopter steps, and then fine-tune with quarter diopter steps. And finally, 3 clicks to blur. Add quarter diopter steps of plus power until the 20/20 line is impossible to read. This should take 3 clicks. And that's it. We've done it. And because you've avoided over-minusing your patient, you enter into the ranks of the titans of refraction. And that's it. That's how you prescribe a pair of glasses using a phoropter. That's called a manifest refraction. I hope this video was helpful to you, and I hope you can use the information to help your patients.